Hi, I'm Carolyn McClanahan. This is the third video of my series on healthcare reform. In the first video, we covered the history of healthcare reform. In the second, we covered the cost of the healthcare system. And now we're going to cover what I call the rise and fall of the Affordable Care Act. So let's get started. First, I want to cover party philosophy. In general, the Democrats have wanted to expand coverage and cost was secondary. The Republicans have wanted to control costs at the expense of not providing coverage that everybody may want or need. So with the Affordable Care Act, the main goal was to provide health insurance coverage for everyone. They wanted to rebuild a primary care system, add a focus of prevention and early care of chronic disease, change the payment methods to rein in costs, and they wanted a public option for health insurance to foster competition with private insurers. First, I want to go through an overview of the law. The Affordable Care Act was a very expansive piece of legislation. It covered not only providing insurance for everybody, but it also made a lot of changes to the healthcare system. So let me take you through each title of the law. We're going to do this in less than 5 minutes. Title I was called Quality Affordable Health Care for All Americans. This was 374 pages, and it was the most important section because it was the thing that put the insurance plan into place. So the whole healthcare.gov and insurance being sold on the exchange and rules around employer-based coverage. Title II was called Role of Public Programs. So this was a lot of significant changes to Medicare and Medicaid. That section was 221 pages long, so it's a big law. Title III was a really important section for physicians. It was called Improving Quality and Efficiency of Healthcare, 501 pages, and that was really dedicated to payment reform. You know, right now we have a fee-for-service system where doctors get paid more to do more, and part of the Affordable Care Act was to gradually move us to a values-based payment system where they got paid more for better delivery of care and better outcomes. Also, it started the creation of things like the accountable care organizations where groups of doctors were supposed to take care of you, and the creation of patient-centered medical homes. Unfortunately, a lot of cuts to the law from 2010 through 2014, especially when the Republicans took over the House and Senate in 2012, mitigated all of these good parts of the law being put into place. Title IV was another great section, Prevention of Chronic Disease and Improving Health, 130 pages that was going to tackle our problems in our country like obesity and diabetes. Unfortunately, this is a part of the law that got mitigated through cuts in funding. And then Title V, same thing, healthcare workforce. I call this the jobs bill. We have decimated our primary care system in this country, and that started back in the 1960s and 70s with fee-for-service, and specialists started taking over the control of how healthcare was paid for. And so through the decades, primary care has been marginalized and fewer people become primary care doctors. Unfortunately, primary care is very important to maintain control of health in our country. And since we don't have a good primary care system, we're not doing a great job of prevention of obesity and diabetes. Other countries have great primary care workforces and do a much better job maintaining the health of their country. Title VI was called Transparency and Program Integrity. This was dedicated to preventing fraud and abuse in the system, and it did a good job of that. We were able to recoup a lot of Medicare dollars that were spent on fraud, so we reduced Medicare fraud through the years. Title VII, Improving Access to Innovative Therapies, sounded very exciting, but this was basically to improve access to generic drugs. Unfortunately, that really hasn't happened, and we're still having a significant problem with drug prices in this country. Title VIII, this was a part of law that actually was repealed. It was called the Community Living Assistance Services and Support Act, and it was dedicated to creating a long-term care insurance program in the United States. Long-term care is very expensive, and we have more and more people as we age or who are going to have dementia and other significant issues where they're going to need long-term care. This was Ted Kennedy's baby, and he unfortunately died while the law was being put into place, and because of that, they really wanted to include this part of the law in the ACA, and they did, but it was not a good way to pay for long-term care. And as the Department of Health and Human Services started implementing it, they had said, gosh, we really can't do this. So this part of the law was actually repealed. Title IX, revenue provisions, that's how we were going to pay for the law. That was the tax bill. So that's what implemented a lot of the things people are complaining about today, like the 0.9% increase in Medicare tax for high earners and the 3.8% capital gains tax for people who are high earners. So, and a lot of things in there that especially corporations would like to see repealed, and that's what the Republicans are trying to do today, is repeal some of those taxes. And finally, Title X was called Strengthening Quality, Affordable Health Care for All Americans. And so you remember Title I was called Quality, Affordable Health Care for All Americans. And so they already had to strengthen the law within the same law. And this was what I call the bucket list. So it had all those little favors and things that needed to happen for the politicians to actually vote for the law. So that's kind of how it passed. So what went wrong with the Affordable Care Act? I call it death by 1,000 pinpricks. Coverage expansion took precedence over cost control. And so costs continued to bloom unchecked. People saw their premiums escalate significantly, and this was part the fault of the Affordable Care Act, but it was more the fault that we didn't try to fix the healthcare system to bring down healthcare costs in the first place. It also made a complicated health insurance system much more complicated. Now you could get coverage through your employer, or you could buy it on the exchange. And part of the problem with this is there were so many different rules that you had to think about to avoid penalties, to make certain you got the coverage that you need. So it made getting health insurance tough. Now, the lack of Medicaid expansion was another thing that hurt people in states where they did not expand Medicaid. So what happened, you had a very poor population who didn't have any access to insurance or health care. And all states were supposed to expand Medicaid that would take care of those people. In states where that didn't happen, people continued to go to the emergency room. Healthcare costs still continued to escalate. So premiums in states that didn't expand Medicaid especially took a hard hit. So that was a huge issue, and it continues to be a fight till this day, because some states are saying, why didn't we expand Medicaid? Funding for good parts of the law got cut. So especially the big things like rebuilding primary care, rebuilding community health centers. Community health centers were supposed to be funded to take care of 50 million people. That funding got cut very quickly. They had the infrastructure ready to take care of that many people. Now they only take care of about 25 million people, and they do a great job of providing basic primary care through their centers at very cost-effective primary care. So cost control measures were to happen later in the cycle. And again, we were moving from a fee-for-service system where people got paid by how much they did to what's called a values-based payment system, and that really didn't get implemented and it still isn't implemented to help us bring down healthcare costs. So that's that is the Affordable Care Act in a nutshell. And it's still the law of the land today. In fact, right now, I'm recording this November 4th, it is open enrollment for the Affordable Care Act. And if you know somebody who doesn't have health insurance, and especially if their income is below 400% poverty level, they can get health insurance very cheaply on the exchange. So make certain your friends know about that, and until they figure out something better, the Affordable Care Act is what stands, and hopefully our politicians will start towards either repairing the Affordable Care Act or coming up with something better. They're still trying. Thank you so much for listening. Our next video will be on what the Republicans are doing with health care, and I'll specifically go through the American Health Care Act.